Welcome to The Explainer. You know, trying to figure out private insurance for ALS care, it can feel like a total maze. So today, we're going to break it all down, give you a clear roadmap, and really, the tools you need to handle it with confidence.
All right, let's kick things off with this really powerful reminder from the source material. This whole journey, it's about empowering yourself. And knowledge is seriously your #1 tool. The more you know, the less time you're stuck fighting with paperwork, right? And the more time you have to focus on what really matters.
Okay, let's get into it and build your insurance toolkit. First things first, we've got to demystify some of these key terms you're going to run into. This way, you're the one in control of the conversation with your provider, not the other way around.
And hey, just by tuning in, you're already taking a huge proactive step. That's awesome. It's also really encouraging to know there are actual regulations in place to back you up. Things that prevent insurance plans from just denying you coverage because of a pre-existing condition. Okay, first up, the deductible. The easiest way to think about this, it's kind of like a cover charge for your healthcare for the year. Once you've paid that amount out of pocket, then your insurance company starts to jump in and pay its share.
Then you've got the copay. So after you've hit that deductible we just talked about, this is the simple, flat fee you'll pay each time you do something specific, like see a specialist or grab a prescription. You know, maybe $40 for a visit. It just makes your day-to-day costs super predictable.
And this one is probably the most important of all, the out-of-pocket maximum. This is the absolute ceiling on what you have to spend in a year. Once you hit this number, your insurance plan pays for 100% of your covered services. It's truly your ultimate financial safety net.
All right, so let's keep building on this. Now we're going to look at how different types of insurance plans can all work together to create that strong financial safety net we're talking about.
So when you're picking a health plan, you're usually looking at two main players, HMOs and PPOs. And look, for ALS care, the biggest difference really boils down to one word: flexibility. A PPO gives you the freedom to see specialists outside of their network, and you don't need a referral. That could be a total game changer. An HMO, on the other hand, might save you some money on premiums, but you're locked into their network of doctors.
But it's not just about health insurance, right? These other policies, they are absolutely crucial pieces of the puzzle. You've got disability insurance to bring in income, long-term care to help pay for caregivers, and life insurance to make sure your family's future is secure. It's about creating that complete peace of mind. Okay, so you've got the right plan. Now what? What kind of real, tangible support can you actually get for ALS care? Let's dive into the key things that are usually covered. You know, truly comprehensive coverage goes way beyond just a trip to the doctor. A really solid private plan is designed to support your quality of life, covering literally everything from essential medications and respiratory support to power wheelchairs and communication devices. And it doesn't stop there. It even includes mental health services for the whole family. So, what's the secret to getting all these amazing services covered? It almost always comes down to two little words: medically necessary. This is the magic phrase insurance companies look for. That's why having strong, super clear documentation from your doctor explaining exactly why something is essential, well, that's what gets things approved.
Now let's be real. The path isn't always a straight line. You might run into bureaucratic hurdles, you might get a claim denied. It happens. So let's talk about those challenges, and more importantly, how you can totally overcome them.
Getting that claim denied notice? It can feel so defeating. But listen, it is not the final word. Seriously, think of it as the starting pistol for the process, not the finish line. You have to remember that so many of these initial denials get overturned when you appeal them.
So here's your playbook for fighting back against a denial. Number 1, act fast. Those deadlines are no joke. Next, you got to gather your evidence. We're talking letters from doctors, anything that proves medical necessity. Third, be persistent. It might take a few tries, so don't give up. And finally, get help. You don't have to go it alone. Case managers, insurance advocates, they're there to be in your corner.
Okay, let's zoom out for a second and see how all these different threads we've been talking about weave together. How do they create that complete support system that gives you security and lets you focus on what really matters, your health?
You see, a real financial safety net, it isn't just one policy. It's a whole team of plans working together. You've got your health insurance covering the medical side, disability insurance replacing your income, long-term care paying for daily help, and life insurance protecting your family's future.
Each piece is tackling a different kind of financial risk.
And here's a pro tip. It's absolutely vital to coordinate your private plan with government support. A lot of people don't know this, but people with ALS can qualify for Medicare early through SSDI, and there's no waiting period. Using your private insurance to plug any gaps in Medicare, that's a seriously powerful strategy to get the most out of your benefits.
And please, always remember, you are not alone in this, not even close. Connecting with patient-led communities like ALS.Community can give you such invaluable, up-to-the-minute insights and just encouragement from other people who get it, who are on a similar journey.
So we want to leave you with this question to think about. What's the very first step you'll take to strengthen your support system? Maybe it's reviewing your policy. Maybe it's reaching out to a support group. Whatever it is, just remember that every single small, informed action you take is a huge step forward. It's a step you take with confidence and with control.